Okay, great. Well, welcome everyone. My name is Joanna Cohn. I'm the director of the Institute for Global Tobacco Control here at the Johns Hopkins Bloomberg School of Public Health. And I'm really excited about today's Innovations in Tobacco Control seminar. I'm very pleased to introduce Yolonda Richardson, who's currently the Executive Vice President of Global Programs at the Campaign for Tobacco-Free Kids. Now, she has a BA degree from Dillard University in New Orleans, and then also has a Juris Doctorate from Yale University School of Law and an MPH from Columbia. She has tons of experience, and you would think she's worked in tobacco control for her whole life, and she does a super job in that area, overseeing all the international program work through the Bloomberg Initiative for Tobacco Control at the Campaign for Tobacco-Free Kids, and is also getting into some of their other public health programs work. But she didn't always do this type of work. Previously, she was president and founder of Richardson Consulting, and where she specialized in providing senior level strategic support and expertise to nonprofit organizations, foundations, corporate philanthropies, and global development issues. She's also worked a lot on women's rights. She was president and CEO of the Center for Development and Population Activities, looking to advance women's rights and expand access to health and other services. She served as a special counsel for the African Development Foundation. She spent 10 years at Carnegie Corporation of New York. So she's really considered not only an expert in tobacco control, but also on gender and international development, global health, philanthropies, and corporate social responsibility. She's also served on a number of boards of several national and international organizations. So a lot of experience behind her, and she's here to talk about the intersection of tobacco policy and research and how to really achieve success in tobacco control policy making globally. So, Yolanda, thanks so much for being here.
Okay, good morning. Can you hear me? Great, it's good to be here. It feels a little false to stand at the podium, so I may move around as I talk, but it's really a pleasure to be here. As Joanna indicated, my early career focused a lot on reproductive health and HIV/AIDS. And when I considered moving into tobacco control, my first thought was, well, it's certainly a lot less sexy than HIV and reproductive health. Let's see how this goes. But it's been a really wonderful part of my career, I have to say. And part of that reason is because if you're at all a little bit geeky, tobacco control is the issue for you. It is data rich in how you have to think about it, data rich in how you have to work in the field. And so it's just been really a pleasure to sort of be a little bit geeky and a little bit nerdy about something that I feel very strongly about in terms of public health. So it relates very much to today's topic about how in tobacco control we use research, we use data, how it informs what we do. So I will talk a little bit about that, and then I will talk about a couple of case studies to show concretely how we as advocates use data, use research, and sometimes it's in surprising ways. There are some ways that it's obvious and some that are less obvious. But I thought I'd start off with just a quick overview of tobacco control. So let's do that. So my favorite smoking baby from Indonesia, believe it or not, this went viral a couple of years ago. This is a toddler who was a chain smoker in Indonesia, but it does indicate, I think, quite visually how much tobacco use exists in low and middle income countries. The tobacco industry has clearly shifted its markets away from developed countries and into low and middle income countries, and for that reason, it is why tobacco use is the leading preventable cause of death and disease in the world. Just a couple of stats to remind ourselves about kind of how devastating it is. Nearly 6 million people die each year from tobacco control. The projections are that by this isn't, okay, just one second. The projections are that tobacco use will reach 1 billion people in the 21st century, and that 80% of those deaths will be in low and middle income countries. It's very clear, all the data shows how much the tobacco industry has shifted its focus away from high income countries with high regulatory and well-developed regulatory systems to lower regulatory systems and thriving potential markets. So I love to talk about tobacco control because I have worked on a number of public health issues, and to talk about and start sort of framing the issue in terms of why tobacco prevention as a public health issue is so different from other public health issues. And I'd love to just kind of see how people react to that. So any sort of hands about why tobacco is different from reproductive health or HIV or other public health issues that we all work on? Any sense of that? Sure. That's one thing, absolutely. It makes it different. Brian? There's an industry behind it. That is a big difference. Anything else? Well, the one thing that isn't so obvious and very relevant for today's topic is that tobacco control requires a policy response. It's not like other public issues where you do behavioral change work or community-based work, or you focus on services, or you focus on health systems. It is very, very policy focused. If you want to make a difference in terms of reducing tobacco control, you have to have a policy agenda, and it is why data and research are so critical in formulating those policies. So the good news about tobacco control is that there's global consensus about what works. There's tons of science around tobacco control at a level of granularity you would never imagine. It's a very technical field, but there is global consensus about what is effective and what we need to do. And that global consensus is codified in the Framework Convention for Tobacco Control, a treaty signed by 192 member states of the World Health Organization, the only public health treaty of its type. And it has been really quite impressive as a global treaty. There was lots of skepticism at its early initiation about whether or not WHO could even use this treaty function. But in fact, it's been quite successful because so many countries were a part of the process and have ultimately signed it. So if you look quickly at a map of the world, you will see that 180 countries have now ratified the Framework Convention. So again, global consensus about what works and why it works. There's some very interesting and obvious outliers in terms of countries that haven't signed. You'll see very prominently there, the United States of America. We don't actually have the great reputation for signing global treaties of any kind, but we certainly haven't done this, and the reasons are complex and varied. But also have a lot to do with the strength of the tobacco movement in this industry in this country. You'll see in South America, Argentina, the next biggest country over there is Indonesia, and then there are a couple other smaller outlier countries. But for the most part, this treaty is well received, and the science that supports it is very well developed. That science is also, again, codified at the technical level in a document called the Empower Framework, where it is very rigorously defined the framework for how to, in fact, influence tobacco control policy. And there are interventions there that are very explicitly, all of us work on who work in tobacco control, trying to insist that there are a couple of key policies that need to happen. The first two, monitor and protect. Monitor is all about surveillance. This, the field, as I said, is heavily data requires lots of data, lots of research, so surveillance is really critically important. And prior to the Bloomberg Initiative, the surveillance data was patchy at best. The other one that's much more service focused and not policy focused is the one around cessation, and it focuses on providing cessation services. But the other four are all policy focused, and therefore, again, require us to think about policy and make sure that we can document it well. So in the Empower framework, the monitor, the M, monitor, is very much about global surveillance. And so as you can see, just very much in terms of what countries are asked to do as a part of the Framework Convention is to make sure they have really good surveillance systems. So one of the investments of the Bloomberg system has been the development of a really good global surveillance system. The Centers for Disease Control has been the Bloomberg partner that's been responsible for ensuring the development of a very rich tool that helps us capture what's going on in terms of prevalence, but also gives us very rich data in terms of public perceptions of tobacco control that's really helpful and informative for policy. To date, 36 countries have completed the Global Adult Tobacco Survey, and some of them are going into their second wave. So we actually begin to be able to develop trend data between those first two data points of the initial GAT survey now to a second GAT survey that tells us whether the work we're doing is really making an impact. And then an additional 54 countries have some portion of the global GAT survey embedded into their own national surveys. And so we are able to track at a global level, at least at the level of 54 countries, to see what's happening in terms of good trend data around prevalence and, as I said, a lot of other data-rich things that we need. So surveillance is an obvious way in which research intersects with tobacco control, but I want to suggest to you that there are a whole range of other things that are really important in terms of how data and how research is used in tobacco control to advance policy. And one of the really important things is that tobacco control, which is one of the things I said that keeps it interesting, keeps it stimulating, in addition to the fact that you have this incredible industry who is countering every single move, is that it's very, 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 I think, interdisciplinary in its approach. So the research is not just the research of epidemiologists, it's the research of anthropologists, it's the research of economists, it's the research of other kinds of health professionals. So very, very, very interdisciplinary in terms of how you have to use data and use research to inform policy. So I'm going to walk you through a couple of them, and it's much richer than what I have probably even been able to surmise, but we can certainly have that conversation. I'd love to make sure we have this as interactive as possible. So I'm suggesting there are 4 possible ways in which data is used in tobacco control that's important for advancing it. The first is really to motivate policymakers to act. And so I'm going to walk you through a case study where I think this is really most compelling, where we've been able to put together data. We already know that it's been motivation. The science in tobacco control has been motivating at a global level, but at a country level, one of the things that remains pretty consistent across countries is the need for locally generated data. People and countries tend to think that even if there's global data, even if there's global best practices, we want to know how this plays in our town, how this plays in our country. So the demand for locally driven data is really important, and so I'm going to walk you through some of that in terms of how that may motivate policymakers. Another case study I'll do for you is how data helps us to isolate how we need to move forward. And in this case, I'll walk you through a case study that talks about having good data helps us to really isolate where problems are, redefine our policy responses, and to make sure that we're actually making the kind of policy difference that we want. Policy also helps us to innovate. It tells us when we have reached sort of a turning point where we need to try something different, move in a different direction, change how we're thinking about the problem, and I'll walk you through what I think is a really interesting case study about how we've used data to push for innovation. And then lastly, but certainly not least of which, is how policy can be used to really help preempt, and in this case I'm talking about how it's helped preempt industry arguments in tobacco control. So, should we get started and walk through a couple of case studies? They're really fun things, ones I hope you'll find. So on the motivate, this is India. So India is an interesting country. India is, as you know, soon to be the largest country in the world. It has a substantial problem in terms of tobacco, but the problem in India around tobacco is interesting. It is not just a problem of smoking. It is substantially a problem of smoked products. So you'll see this very graphic picture of a victim of smokeless tobacco. And so we really wanted to motivate the government to do something about it. Smokeless tobacco had the benefit of being very visually able to raise policymaker concern. When you see a picture of like this, you know in very concrete terms that there are public health implications of inaction. And so what we did was really try to gather as much data as we possibly could around the impacts of smokeless products. So we obviously pulled together all of the scientific data around prevalence to show the prevalence of smokeless tobacco. The other tobacco product that is quite heavily used in India is what's called bidis. It's a locally produced cigarette, so not an internationally produced one. And so it was very much a part of the culture and fabric. Both smokeless and BDs were two products that pretty much defied regulation in India. India had pretty much regulated smoking, and primarily smoking of cigarettes, which is the part of the prevalence data in India where there is actually the less significant in terms of tobacco use. Smokeless products and BDs were actually had higher prevalence rates and had the unique feature of being, in the case of smokeless, being used by women. One of the things that keeps us fairly optimistic about the tobacco prevalence globally is that in Asia, most countries in Asia, women don't tend to smoke as much as men, their prevalence rates. But in India, on smokeless products, women tend to smoke quite a bit. And so they form the vast majority of the tobacco market locally in India, with cigarettes only comprising 14%. So first step was just to get the data out there. This doesn't happen magically. It requires scientists and advocates working very closely together and putting things in a format that is needed. So we did a couple of things to try to generate demand and motivate the Indian government to act that were very data intensive. First, we had them understand the prevalence data, so basic prevalence. We did some modeling to show what would be the impact if, in fact, taxes were increases on these two undertaxed products in terms of lives saved. So some epidemiological research was done to really show what the impact would be. We partnered with Hopkins to do that modeling work, and it was actually quite successful in getting, along with the very visual nature of smokeless tobacco, getting the Indian government, particularly Indian states, to begin to act. We also did a lot of work on economic impact, because one of the arguments that kept coming back was that the BD industry, which is disproportionately populated with women and sometimes children, would actually be devastated if these products were taxed. So we pulled together the best economic data to show that those arguments just didn't hold weight. So you can see a pretty data-rich approach of getting information in terms of policymakers, not just prevalence data, not just surveillance data, but really, really rich, trying to understand what could get them to be motivated. This work, this data, this research, coupled with very vigorous advocacy campaign and a very visual one, using victims of tobacco control, really shows how when researchers and advocates work together, policymakers can be motivated to, in fact, act. The great success of this campaign was that many countries, many states increased their tobacco taxes, and they increased them on BDs and smokeless products which had never been taxed before. So that was a big win. It just was not in the DNA or the culture of India to even think that they could tackle either one of those products, because they were so prevalent and prevalently smoked. BDs is called the poor man's cigarette, so they didn't really want to politically touch it. And then in addition to that, as a result of this campaign, 29 territories in India banned gutka, which is the most, was the most common form of smokeless tobacco in India. And so it was completely and totally banned, mainly because many of the states just felt like they didn't want to bother with regulating. It was just way too tough to do that, so they just banned it altogether. And this was a huge, huge victory for tobacco control. Okay. So isolating, how have we used data and research to really isolate and really nuance what the policy approach should be? I told you there are those 4 approaches that are part of the Framework Convention, which is to ban advertising, make smoke-free places, make all public places smoke-free, to educate consumers through graphic health warnings, and then to raise taxes. But that's at the sort of 20,000 foot level, but then you get to a level of nuance. So how have we used data and research to really isolate what is the correct policy prescription going forward? So I thought I would share with you Turkey as a good example. So Turkey has, much to the surprise of many of us in tobacco control, really sort of emerged as a global champion in tobacco control. The Bloomberg people like to say that Turkey is the place that has implemented each of the empower elements, those 6 elements, at the highest level requested and demanded by the Framework Convention and the guidelines. And so it was already a success story. But we knew that there were some implementation challenges. And so, again, partnering with Hopkins and others, Bloomberg decided to really do some more nuanced work around, how could we figure out where there were the biggest sort of implementation challenges. And so we began to look at where we could find that. So again, Turkey context, now 27% of Turkish people spoke, but the rate had been at higher than that, at 31% when the first GAT went out. Most of these were men. Again, people like to talk and say that, you smoke like a Turk because smoking was so prevalent, so everywhere, that the notion of doing something in tobacco control just seemed a pie in the sky at the time that we all started working in Turkey. But to date, as I said, Turkey is a leader in tobacco control. In 2008, Turkey passed a smoke-free law. That law had some problems in it, one of which was an exclusion which allowed smoking to exist in outside terraces to restaurants. One of the things we like in tobacco control to do is to make sure that policy prescriptions are comprehensive, because every sort of exception creates implementation challenges. And you can tell policymakers this as much as you want, but they always think, oh, we don't want to overreach, we don't want to be draconian, we don't want to punish smokers. But the reality is, when you create those exceptions, they create implementation challenges. So what's the best way to prove that to them, that implementation challenges exist, is to do a compliance study and look at the data and show them what the implications are. So that's what we did. We went out and did work to try to figure out what were the implications. Well, not we, Tobacco Com, but the collective of Bloomberg, and again led by folks here at Hopkins, to do compliance monitoring in Turkey to figure out what was really going on in terms of this. And because of that, because we were able to document how significant that loophole was in making implementation in that country difficult, and making it more challenging and confusing the public, what's a terrorist, what's not a terrorist, what's outside, what's connected, what's not connected, the Turkish government responded, and in 2011, right following that compliance study, rescinded that loophole and began to and to eliminate smoking even on outside terraces, which is really important. The tobacco industry loves this loophole because with this loophole, it can generate tons of confusion. And then all of these hospitality venues tend to sort of go and say, how can I get a terrace? How can I make my thing a terrace? Can I put a little veranda here? And then all of a sudden I've got a terrace. So again, it's why we really try to emphasize this. But it's a real use of how deploying a multi-city, multi-venue compliance monitoring survey in that country was able to provide the government with enough evidence for them to act, as opposed to just say, and then they could say to the public, it's not too draconian, we really are not able to implement this well in a way that the public understands and that actually achieves the public health outcomes that we want. So that's isolate. Innovate. Data helps us to innovate. I'm not doing a good job with my water. Data helps us to innovate. Again, we know what works in tobacco control. We know that when you put all 4 of these policy prescriptions in place, tobacco prevalence will go down. We know that unequivocally. But what happens when you've done all of that work? What are the next generation of issues? So I want to highlight Brazil, because Brazil has been a real, again, success story in tobacco control. It started more than 20 years ago, putting in place tobacco control in a very effective and rigorous way. There were some increments along. It didn't get it perfectly in the initial stages, but all along the way, Brazil continued to get better and better tobacco control policies put in place. But even from the early stages, Brazil was considered a global leader. It put very, very strong policies in place. To today, the state of play is that there are 100% smoke-free public places, large graphic health warnings, comprehensive ban on tobacco control, although there are some exceptions, and you've seen a steady decline. You can see that decline here. So here all the way back to 1989, you can see what prevalence rates look like in Brazil, and you can see how with each sort of step in putting policy in place, Brazil began to show declines. So Brazil just went through a second round of GATS-like survey data. It didn't do a full and comprehensive GATS. It actually was one of those countries that integrated GATS surveillance data into its own national tool. And Brazil discovered that a couple of things. The prevalence rate did drop, but there was a problem in terms of potential increases in prevalence among young people. And so Brazil once again said, okay, we're doing well. The prevalence data is going down, but we've got to keep pushing. And they have all of the current policies in place for the most part, including having fairly high taxes. Tobacco products are still too affordable in Brazil, so even though it sort of meets global standards in terms of how well the products are taxed, it's still too affordable, so that's an additional issue. But it's also provided the tools and information for advocates to basically applaud policymakers and say, bravo, fantastic job. You've shown that by implementing policy over time, the trend lines in terms of prevalence can go down. You still are indicating that they are seeing in the data that there's some problems, and so now we have to push to continue to innovate. As a result of those internal conversations among advocates, when we could probably sort of almost walk away from Brazil and say, we're kind of done. Brazil has done it all. And they have fairly good enforcement systems. They still have, it isn't all 100% perfect, but it's pretty good. And they've nearly halved their prevalence rates. But instead of that, advocates said, and have been motivating and talking with policymakers, that we've got to keep innovating if we want to keep seeing these trend lines go down. So just recently, and these are some of the things that are kind of in the Brazil environment that are still kind of going on, including the industry's huge pushback against Anvisa, which is Brazil's regulatory agency, because one of the things that Brazil had decided to do was to really begin to take a look at product regulation content. And so what that means is that they decided to, because they put all these other policies in place, start to really look very rigorously at how to regulate the content of cigarettes, what's actually in cigarettes. And they decided to put in place a ban on any enhancing additives, which made cigarettes easier either to smoke or made them more attractive to young people, all flavorings, all attributable things. And so the tobacco industry pushed back in a huge way, basically sued Anvisa, the regulatory agency, even put in place a national introduced legislation which would basically strip it of its authority to regulate tobacco control. I mean, they pushed back pretty aggressively when Brazil took this step to try to ban certain additives. At the time when Brazil announced the ban on additives, it was one of the few countries who had taken that step to do it in a very, very comprehensive fashion. And so it was a big deal when the tobacco industry decided to push back. But Brazil is still fighting this. We're still supporting them in doing that. But in addition to that, they've said, well, we're not only going to do that, tobacco industry, but we're also going to introduce legislation that is for plain packaging. So there is now currently a comprehensive bill in the Brazilian parliament that would both try to clarify, because of the tobacco industry suit, Anvisa's authority to regulate products, including banning additives, introduce standardized packaging, which is basically having very, all tobacco products have to look exactly the same, removing all branding, so tobacco industry can't brand its products. This is something that has the tobacco industry quite up in arms. And then deal with one last loophole in its law, which does not ban products at point of sale. So what has happened as countries have taken on more advertising bans is the tobacco industry itself has innovated and made the place at retail where products are purchased, has made that their advertising venue. And so a number of countries that comprehensively banned advertising have this loophole. So that needs to be pretty well defined in the law. But again, you can see how prevalence data around, kind of what was going on in terms of needing to address youth really help, again, have policymakers focus and have advocates put in place demands to suggest to Brazil that even though you had done a lot of work, still more to do, time to innovate, time to get creative, and continue to push. Okay, so the last example is preempt. I think it probably looks a little weird that I have olives, but remember that picture. I'll talk to you about it in a little bit as we talk about that. So when we were talking earlier, I had asked, what's different about tobacco control? And you rightly pointed out that the tobacco industry is what's different about tobacco control as a public health issue. We have an active, powerful, very strong adversary in the industry, and they have clearly decided that their new markets are in low and middle income countries, primarily because they feel like the regulations in high income countries have made it prohibitive for them to expand their markets. They can obviously keep to some extent the smokers who are already addicted to their products, but getting an opportunity to expand those markets is getting more and more restrictive. So what have they done? They've shifted their markets to other places. And now there are only 2 places in the world that still really represent growth markets for them. One is Middle East and Africa, and that's really where they're doing a lot of work. And then Asia Pacific, we still have a lot more work, but you can see almost every place else those markets are declining. So the tobacco industry constantly innovating, constantly putting misinformation out there about tobacco control. And so again, we've had to rely very heavily on the research community so that we could respond in kind, both to the misinformation, but also to the what they're trying to say about this. So Australia is a perfect example of how they really worked hard to preempt the tobacco industry from preventing them from putting in place a very strong policy, which was their standardized packaging. I think the work that the research community did in Brazil is obviously world-class and stellar in preparation for the implementation of this policy. They did tons of focus groups. Again, this wasn't just epi data or surveillance data. They brought marketing folks in to look at kind of what's attractive to consumers. So it was kind of outside the bandwidth of most tobacco control or public health folks. They actually got folks in to say, how can we make this package as unattractive as possible for consumers? What colors do we need to use? What packaging do you use? How graphic should we make the pictures? We don't want anybody to pick up, a pack of cigarettes and think that they're cool or sexy or all those other marketing images that the tobacco industry's done. And they did tons of research. I mean, it is voluminous if you go to the website there about just kind of all of the data they did in preparation for this regulation. So again, an opportunity for tobacco control and public health people to work with in a multidisciplinary way with folks outside of public health to put together all of the data they needed to document in their legislative history and for policymakers why this policy prescription made sense. And so it's a real testament, if ever you want to be really nerdy about something, going through all of that data is just amazing to see how good a job they did in preparing for any possible industry argument and making sure that they had that well documented. So I put the olive on that preempt slide, as you recall. One of the stories that I like to tell about the Australia that the Minister of Health tells there about the olive industry, they eventually, after they'd done all the marketing research, decided that olive green was the color of the package. And it was considered by all the consumers to be the ugliest color you could put it in. Well, the olive growers were not that happy about this. So when the Minister of Health announced that the plain packaging would be in, an ugly olive green, the olive growers wrote her and let her know they didn't really appreciate that. So it was just one of those things. I guess the one piece of research they didn't do was to just probably research what the response might be of the olive growing industry. But it's a funny story about just kind of how well developed, well orchestrated the research community was with the advocacy community and with policymakers in making sure that policy was informed by the best that science could produce. So I think one of the things that's always difficult for us as public health advocates is that we tend to think that, the data will tell the full story. I hope these case studies have helped at least engender in your mind that it isn't just about the production of surveillance data or prevalence data. It is really a well-orchestrated kind of attempt to understand what are policymakers thinking, what kind of information do they need, what don't they know, what surprises them, and then packaging it in a way that allows them to see easily what the desired policy prescription is, not just assuming that they will make the logical leap between, surveillance data or prevalence data and say, oh, let's all just get to work because we understand it and get it. And so I just think that we've learned in tobacco control, and I'm sure other fields have also learned as well, that we just have to make sure we package it, get it out there, understand it in a way that policymakers can really understand. And we have to make sure that we are working in a way that brings in more than public health professionals and public health researchers, because this all takes place in a political context where, who knows what a given policymaker or decision maker is animated by. And so we have to just be prepared to roll up our sleeves and work hand in hand with the research community, both in public health and beyond public health, to get the information that's going to be most responsive to those policymakers. And then we have to be able to make sure that we are always, as I said, thinking preemptively about what the industry is going to say and what they're going to do. One of their favorite things to do, I love, and again, the data out there is they always tell restaurant owners that if the smoke-free law goes into effect, restaurants are going to lose business, and it's just not true. So again, it's one of those things where we preempt, and we have worked with economists to do, economic impact studies. We've worked with epidemiologists to look at kind of like how smoke-free is actually beneficial, because you see reductions in visits for cardiovascular disease. So just a whole wealth of data, and I think it's what makes the field of tobacco control fun, because it does force that collaboration with the research community. It forces the researchers to think like advocates, and it forces advocates to think like researchers. We do that imperfectly, but we do it. And that's what makes the field continually interesting. All of that research, all of that work has to take the science, the best practices of science, get it to policymakers in a package, so that partnership between advocates and researchers is real and important and critical to tobacco control. So, thanks.
Yolanda, thanks for that presentation. I liked your sort of framework for thinking about the different ways that data can help policy. Are there, just from your experience over these past few years, are there certain types of research or approaches that are more helpful to your work than others? I don't know if there's anything you can say about that.
Yeah, I mean, I think now we kind of know the policy terrain, so we can anticipate what kind of research needs to happen. Sometimes we don't know, because as I said, what animates a policymaker just really depends. But we know like economic impact studies are really good. We know that compliance data is really good. We know evaluative data is really good, that show that different kind of policies have different kind of impact. We know comparative studies are really helpful when we can quickly say to policymakers, this policy has this was tried here, here, and here, and this is the implication of it. For raising taxes, we know we need to do good research around illicit trade, size, scope of the illicit trade market. So, I mean, I think there are categories of data that we know, but then there are occasionally surprises where, I know, sort of makes you guys pull your hair out. We need data tomorrow that shows X. And you're like, yeah, right. We're going to be able to put that together in a minute. But to the extent that we can anticipate that there are some kinds of things that always come up in a policy fight, yeah, we know what those are.
Thanks so much, Yolanda. The example you gave from Brazil, trying to begin to tackle product regulation, is really interesting in the U.S. context. I know you're global, but the idea of being able to regulate the product in terms of additives, there's specific challenges in the U.S., but we have the authority right now to, in theory, regulate almost every dimension of the product.
Right.
Do you think there's specific things we should be looking for internationally to help inform product regulation in the U.S. context? Are there other jurisdictions, or is this something that you guys are thinking about in terms of how we can take learnings internationally and apply it domestically?
In terms of the product regulation
Yeah.
specifically, yeah, I mean, globally, product regulation has not been a real area of focus, and there aren't many countries that are far out there on product regulation. I mean, I think when Brazil, there's some, and it's starting to change. When Brazil put its additives ban in place, it was pretty out there, and that's why I said it was pretty on the innovative side. There were part of the reason why it makes it difficult, and even the challenge that Brazil is showing, is that Brazil had, invested, when it first did its tobacco control law, invested in having tobacco companies really define what's in their products. So they had 20 years of research. And they could then very well document with that 20 years of research how the tobacco industry had engineered the products to try to increase addictiveness, appeal, et cetera. So again, they had just tons of data. And so a lot of countries don't require that tobacco industry expose what's the content of their products, and so they just don't have that history of data. So that's the lesson. In fact, it was wonderful a couple of years ago, I think it's been now, we had folks from Brazil come to talk to the folks at FDA about how to do this. It's lovely, I love that. Because they had, for 20 years, they had all this data, and they could absolutely, and when they started collecting it, they weren't even really sure how they would use it, but when they started really looking at it, they really realized and could document how the industry was proactively engineering the product to make it more attractive, more addictive, more everything. We've got some of that data in the United States just through the Master Settlement Agreement, but we haven't had that level of 20-year investment in collecting information. So I think it makes it harder from a public policy support function if you don't have that. I mean, you can do it, because you think of it as global best practices, but as again, most countries want to say, well, why do we need to do that? And so if you can show very explicitly, this is what a tobacco cigarette had in, 1990, and this is how they've changed the content to make it more addictive, appealing, or whatever, it's much more compelling to policymakers. So I don't think there's a whole lot of countries that are as sophisticated as Brazil has been on that topic, but more and more countries are doing it, and so I think we're not far away.
Thanks, Yolanda. So you talked about Turkey as being one of the, examples that we kind of has reached all of its Empower goals. So is there law such that it's like under one umbrella and they don't have like ordinances, mass media ordinance or tax ban? Is it smoke-free and everything is under one law, or is it just still kind of?
Yeah, no, Turkey's law is comprehensive, so there is one umbrella law, but then when you get down to the next level, the regulatory framework for who issues regulation, there's a lot more differences. So the Minister of Finance, for example, would be the person who would be looking at rates of taxation and issuing new and updated decrees about that. You might have an advertising agency or the agency responsible for advertising looking at the ad ban. So once you get to the regulatory stage, where regulations actually have to be put in place to make some of these innovations, unless you're going to do a comprehensive law, then there are lots of other regulatory agencies that are involved, and then they can look at unique aspects of the law. Turkey now has a new national strategy, which seems to indicate that they're going to do similarly to what Brazil has done, is try to think about how to innovate, since they've got all the foundational policies in place and they're fairly strong. There are some seepage I'm hearing in Turkey about implementation, but as you probably all have seen in the news, Turkey is going through a whole other set of political challenges that are unrelated to tobacco control. But their national strategy now has a new set of innovations. And it's not clear to me whether they will do that as a comprehensive law, or whether they will say we can do this through a regulation, or we can do this through amendment of an advertising law. It's just not clear yet, but they are planning another round of innovations. So it really just depends. Where there's political opportunity is greatest. But I mean, Europe is going to, in May, have 3 more countries that are going to put in place plain packaging. None of them are going to probably do it quite as well as Australia, although the UK will come close. They've done a lot of research to justify the policy because they know the tobacco industry is going to sue. But one of the things that's in the Turkey national strategy is moving toward plain packaging. So they probably would do that as a separate law, maybe. So it just depends.
Wondering, so Brazil is a great example of sort of forward thinking, but if in your experience, if there's any real missed opportunities or sort of out of the box kinds of opportunities that you can see coming down the pike in some of these emerging markets or places where there's still a big lever to move, if there's something like a big step we could facilitate.
Yeah. Yeah, I mean, she's just asking what's down the pike in terms of potential other new innovations in other countries other than Brazil. Here's my thinking, and it probably sounds more conservative than I think I really feel. But there's no joke that it really, with having a tobacco industry, policy really does need to be formed based upon the data and the research, because they will sue. There's nothing that supports this. So I don't think we're overly asking countries to leapfrog, to like jump way out there and innovate if you don't have really a track record of doing tobacco control. So everyone's now kind of animated about plain packaging, but Australia has 25 years of doing tobacco control under its belt, and a well-developed scientific community, a well-developed interaction of the scientific community with policymakers and with advocates. So that's a level of sophistication has protected them, and it hasn't even really protected them because they've still got sued. They've gotten sued multiple times in every kind of tribunal around the world. So I think countries should be bold and aggressive. The Framework Convention provides some coverage, but once you start innovating outside of the Framework Convention, you just need to have your I's crossed, your I's dotted and your T's crossed, so that you can justify the policy, because the tobacco industry will inevitably sue, and what we don't want to be doing is spending our time in courts. We want to be out there implementing good policy. So that's the one sort of a little bit of cold water on innovation if you don't have a track record of doing this and you're not really prepared.
Can I ask a follow-up question to that? So plain packaging seems to be taken up as an innovation, but we haven't seen the single pack presentation law from Uruguay really take off, even though it makes sense in many ways. Could you just, so we had a speaker earlier this year talking about the legal battles around that. Do you have a sense of why that particular policy, that there hasn't been interest by other countries in doing something?
Well, at least there's a couple things. One is I think that the trade arbitration isn't settled, so I think countries are probably being a little cautious. And the second is I think that the standardized packaging has just animated the space, because the fight with Australia has been big and bold and ugly and pretty highly advertised. And it drew other countries into it, whereas the Uruguay case that Philip Morris brought against Uruguay is just really bilateral. The WTO action actually put it on a global space where 20 some odd countries are fighting about this in the WTO tribunal. So I just think it got elevated and highlighted when more countries saw, had felt like they had a stake in it. So that may be just why it's there. And I have to say, the Uruguay case, we knew that would be the tougher of the legal issues to defend. We don't really have science that says how big is the right size. We have that bigger is better, but we don't really have science that says it should be this. And that was one of the things the tobacco industry said. Well, how do you know that 80 versus 85 is, I mean, we have some good answers for that, but we don't really have anything. And this is an example of okay, can you guys quickly do a study proving that if you increase it by 5%, you get this result? We don't have that level of nuance. We have bigger is better. And we had even less on the single brand. We got the best minds together to make the strongest possible case, but it's an example of Uruguay trying to innovate, but needing to make sure that the science supported how they were going to innovate. So to be determined. Everything we're hearing, I don't know what the last speaker said, that we are feeling fairly optimistic about the arbitration, that apparently the arbitration hearings went well, so fingers crossed that gets resolved positively for tobacco control.
Any questions? Okay, well, I want to take this opportunity to thank you.
Yeah, you're
all
welcome.
for your presentation on a really important topic.
Yeah.
Thank you.
You're welcome.